Since ancient times, honey is one of the most appreciated product for humankind. In traditional medicine, honey is used as an alternative treatment for many clinical conditions. There are some evidences about application of honey in medicine. Wound healing. Many evidence suggest effectiveness of honey in the control and treatment of acute wounds and for mild to moderate superficial and partial thickness burns. Honey and diabetes. There are strong evidences which indicate the beneficial effects of honey in the treatment of diabetes mellitus. Honey and asthma. Honey is commonly used in folk medicine to treat inflammation, cough, and fever. Chronic bronchitis and bronchial asthma were successfully treated by oral honey consumption and animal modeling. However, future studies are needed to investigate these effects of honey to better understand the mechanisms by which honey reduces asthma symptoms. Honey exerts anxiolytic, antidepressant, anticonvulsant, and antinociceptive effects and ameliorates the oxidative content of the central nervous system. Several studies on honey propose that honey polyphenols have nootropic and neuroprotective properties. Honey and gastrointestinal diseases. Honey has been suggested as potentially useful for various conditions of the gastrointestinal tract, such as periodontal and other oral disorders, dyspepsia, and as part of oral rehydration therapy. Honey no needs to refrigerate and it never spoils. In general, there are approximately 200 compounds in honey such as sugar, protein, enzymes, minerals, vitamins, amino acid, and a wide range of polyphenols. The main composition of honey is carbohydrates. 82% per 100 grams. Honey contains only 17% of water per 100 grams. In honey, main sugars are fructose and glucose, slightly higher fructose. Pure honey also consists of flavonoids, polyphenols, reducing compounds, alkaloids, glycosides, cardiac glycosides, anthraquinone, and volatile compounds. The vitamin level in honey is low and does not close to the recommended daily intake. Honey includes all of the major minerals, such as phosphorus, sodium, calcium, and etc., including many essential trace components, such as silicon, C. rubidium, Herbe. But they also contain some heavy metals such as lead, cadmium, and arsenic. They are danger for human health. Honey also includes 600 volatile components which are biochemically active. The ingredients of honey have been reported to exert antioxidant, antimicrobial, anti-inflammatory, antiproliferative, anti-cancer, and antimetastatic effects. Antioxidant activity. Flavonoids and polyphenols, which act as antioxidants, are two main bioactive molecules present in honey. Honey has the ability to act as a dietary antioxidant. Antioxidant means it can neutralize free radicals. Free radicals can damage cell DNA and promote cancer formation. So, honey can neutralize damaging elements of DNA. The ability of honey for antioxidant properties is related to the brightness of honey. Therefore, the darker honey has higher value of antioxidant. Antimicrobial activity. The main factors for antimicrobial activity of honey are the enzymatic glucose oxidation reaction, and other factors, high osmotic pressure, low pH, glucose oxidase, hydrogen peroxide, and low water activity. The water activity of honey is around 0.6. While, for most food it's over 0.95. Low water activity means less favorable environment for bacterial growth. Antibacterial activity of honey is effective on many bacterial pathogens. Honey also has antiviral and antifungal activity. Honey has anti-cancer action via its apoptotic activity. Honey induces the expression of p53, caspase-3, and proptotic protein BAX, and also downregulates the expression of anti-apoptotic protein BCL2. Its anti-cancer activity has been proved against various types of cancer, including breast, colorectal, renal, prostate, endometrial, cervical, and oral cavity cancers. Honey also has anti-inflammatory action and immunomodulatory properties. Honey increases T and B lymphocytes, antibodies, eosinophils, neutrophils, monocytes, and natural killer cells generation during primary and secondary immune responses in tissue culture.